Customer Operations, Sales, AI, Artificial Intelligence podcast. And for those of you that already been here, you know that this is a podcast when we always discuss a real thing in AI. You know me, I'm not talking here about theories, I'm not talking here about future, we're here down to the earth right now in business. So that's another episode that is going to be like that, especially that the guest I'm so happy to have today on the show is really doing AI in practical way in healthcare, which, as you guys know, needs to be a very responsible way of doing things. For those of you that are new here, welcome and stay with us, stay with me, stay with my guests too. And if you know me, I'm a consultant, so every time I can learn your feedback, it's a treasure for me. So if you see a space of improvement, drop me an email or leave a comment. And otherwise, if you like it, subscribe and come back. We'll talk in here about practical things. Today, I have Josh with me, and I'm super happy he is here because he's very busy entrepreneur building company with AI, which we all know is cannot be hype for entrepreneurs because eventually they need to make money with AI and deliver their promise. So, welcome, Josh, in this podcast, and please introduce yourself to the audience and tell your story, what you've been there through, what you're doing, what you're building.
All right. Well, fantastic, Art. Thank you so much for that little tease of an intro there, and also just having me on. It's been really fun getting to know you at here in Dallas, where we kind of attend a similar networking group and
Yeah,
around AI.
yeah.
So I really appreciate the time and opportunity. So I'll do a slight correction in terms of while I love to bask in the glow of being considered an entrepreneur and be able to wear that mantle, I I would say in this company that I'm at now, Pieces Technology, and we're talking about, the company's been established for over 8 years now, and I've
Okay.
come in at about 4 years ago, really, in a full-time capacity. I've actually known them since their beginnings when they spun off from Parkland Hospital, and 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 the past 4 years I've been there full time. So I'm not like one of the founders who really had to grind, at the day one. I'm more grinding now, 4 years in, when it's like, come on, product market fit, let's just get this over the hump and really get to the next level of scale, right? So I just wanted to kind of give that little color behind it. But I will say though that the spirit of entrepreneurship and just the guts and determination that it takes to just deal with, like, day after day, just constant heartbreak, basically,
Uh-huh.
is still there and still present. So I feel those those early kind of entrepreneur woes. To give a little bit more of my background,
Yes.
I've been a technologist for the past 25 years now. Uh, really been excited and focused on distributed systems from a very
Mm-hmm.
early time. I actually got my sort of studies in grad school around media systems, and when I realized that, boy, my attention for detail and math in the mathematical realm in terms of signal processing and solving all those, nonlinear equations, differential
Mm-hmm.
equations. My brain couldn't quite wrap itself around, but I loved, like, the systems that it took to move all that data and to transform it and then get it all ready for a great algorithm to run somewhere else, or a great filter. So
Mm-hmm.
that's always been kind of in my blood, and something about that and the DevOps angle has just been always there. Whether I've fully embraced it and loved it or not, it's just been there.
Yeah.
So since then, I've I I a coder and a developer for several years at the beginning, and then started getting into the management side of project management and program management. Um, and then yeah, about 5, 6 years ago. And sorry, just to step back there, I would work for various companies and then have my own consulting thing. So
Okay.
I was thinking I was for myself I was more of like a hired gun to come in and transform a team and really ship um, a custom application that they had. So I worked for the airline industries, and they wanted to rebuild their reservation system. I worked for a company called
Mm-hmm.
ITA Software
Mm-hmm.
back
Mm-hmm.
then. That then got bought by Google. Um, I've worked for projects with Vodafone, and I was full time at the New York Stock Exchange, like bringing aftermarket data online. But all in the vein of yeah, building these kind of distributed systems around kind of algorithms and insights.
Interesting.
So yeah, but the
Mm-hmm.
past 4 years, I've really said, you know what, I really am very intrigued by this healthcare space. I'm intrigued by the company too. Like I mentioned, I've known them since the beginning 8 years ago too. Um, and I came in full time, in which my role now is the vice president of engineering and the chief privacy officer. So, I've built up enough technical and management chops where I'm able to, organize and run the application teams, DevOps, SecOps, building
Mm-hmm.
out all the MLOps infrastructure, and partnering really well with our VP of AI. And while that VP of AI is more of the brains and the excuse me,
Mm-hmm.
and the harder research of which model selection, how to really validate and do the discovery of our models, of which I help with a little bit, but this person really is 10 times better and owns that. But we have a good partnership here within pieces to deliver that complete distributed system with the AI engine itself. So
Okay.
that was kind of all over the place. I'll pause there, and obviously, I know we want to talk about the product
Yeah.
too, but I'll pause there.
Yeah, yeah, but I didn't want to interrupt you because it's really like the really like many places you've been there,
Yeah,
and but as I said at the beginning, I'm here today to uncover as much as possible about pieces, the company you work for now, and
yeah,
you help them to grow. And I bet it needs like entrepreneur blood pressure because it's a
yes,
company that is like like also like in this space that requires that you can't really settle down with AI, and we both know it. Um, Tell us, please, what's the company mission? I mean, what you guys want to change and do, and why with AI? There are so many different ways to do stuff you guys do, but you pick up AI. So, what you trying to achieve as a company? What's your big goal?
yeah. So I'll start at our big kind of slogan, and then we'll step into that about the specifics and the people involved that we try to impact.
Mm-hmm.
So the slogan of the company is helping those who help others.
Mm-hmm.
So, as you mentioned, we're in the clinical space, and we're in a
Yeah.
very specific space now of actually inpatient care providers. So, when you get
Mm-hmm.
admitted to a hospital system, you have a care team comprised of typically nurses, case managers, and
Mm-hmm.
doctors, physicians that become your care team to obviously diagnose you and figure out what's going on and deliver health, but then also deal with billing and just get you through that hospital experience. So
Mm-hmm.
we've focused our products on that really inpatient care team space. So your next question of, well, what do you need AI there for?
Mm-hmm.
What what happens in with those care teams is there's a crushing amount of documentation and collaboration just to be able to get somebody through that
Okay.
that experience. Okay. Um, and if you look at it in terms of percentages of time, like a doctor will spend almost half their time documenting. And then the other half
Okay.
is, yeah, bedside and doing and looking at diagnostics and charts and coming up with hypotheses and decisions on diagnoses. But then the other
Mm-hmm.
part is like this huge, massive paper trail
Mm-hmm.
and dealing with the technology to record all of that too. So and it's leading to just a tremendous amount of burnout and just almost to a point of disillusionment with with career choices. Like I've met several doctors, and in fact, some doctors um, actually come and work with us, and they're like, you know what, I don't want to practice anymore. I'd rather kind of work for maybe a
Because of
tech
that
startup
headache. Because of that
because of that
headache.
headache. Yes, I look at them and I see their eyes. It's like all bloodshot and bleary, and
Yeah.
it just feels like they're going from reactive step to reactive step, and then documenting. So like that's just there's something fundamentally wrong there,
Mm-hmm. Mm-hmm.
and and the genesis of the company was founded on uh, predictive modeling. This is back eight
Mm-hmm.
years ago when that was like the cool thing with
Yeah, because that was a cool
linear
time.
regression.
Yeah,
Yeah,
sorry interrupting you. I'm happy you
yeah,
mentioned when the company was actually incepted because I was a time when Gen AI was not a thing. So to those
correct.
that listening us, it's not like they just pick up ChatGPT or Gemini, whatever, 8 years ago and start processing docs. It was a
Right.
time when you need to just step into pure machine learning and other things to make sure you can help them, right?
Exactly, exactly. And so the genesis of the company actually came from Parkland Hospital here in Dallas, and the founder and CEO, Ruben,
Mm-hmm.
he sort of founded a research company based out of Parkland. It was called Parkland Center for Clinical Innovation, PCCI. And that company was about, hey, can we predict things like sepsis shocks? Can we predict rates of
Mm-hmm.
readmission to really
Mm-hmm.
help people on the ground get a sense of, oh, wait a minute, is this patient going to go into an event that I want to be warned about earlier? And also, can I do some preventative medicine now so that they don't get readmitted as quickly? But these are
Mm-hmm.
very much like score-based things where we'd say like readmission risk 0.5%, right? Or
Mm-hmm. Mm-hmm.
sepsis shock high. You know?
Mm-hmm.
So
Mm-hmm.
so so these are using all these structured traditional data science techniques, which were which were really coming into they were having their Gen AI moment back 8 years ago, and the company was founded on those kind of principles and technologies. Then a
Mm-hmm.
couple years later, or actually even around that same time, we were working on the NLP side to look at unstructured notes. Okay, and this is the very it's not the very early days of NLP. NLP has been around for decades, right?
Mm-hmm.
As a scholastic and just mathematical, and even kind of it was still being used in certain industries. But here at Pieces, it was looked at, yeah, can we start processing notes better and you know doing the same things that our lovely LLMs do so well today, looking for content classification, and we were doing summarization, um, using various neural nets and approaches, and old even GPT-2, right? We would take that open source model, um, and back then it was more a sort of piecemeal together a lot of these different techniques and still be able to craft a summary, but using a lot of different NLP, kind of neural net based approaches, and we
Mm-hmm.
did that for years, right? We did that for years, and then obviously recently in the past year and a half, um, it's the advent, the really, I don't say the advent, but just the fact that GPT-3.5 was able to do such great reasoning over the types of tasks that we really wanted to solve and help: summarization, content classification,
Mm-hmm.
Q&A. These are really, really now, and they were just doing it with such better accuracy. We've really embraced those and then used it for the next level of the
Oh,
generative kind of output that we want to see. So
Okay. Okay.
yeah.
And Josh, I want to come back a little bit to that intro, like the care team, like these people that help us to, I mean, without them, we could not go through procedures, complicated, less complicated, more complex stuff. All this happening. We want to just step into the healthcare provider, just take that blood shot, the blood test, take that shot, whatever it is, and then go back home. But those guys have so much work as you expected to, as you explain, they have to do so much things behind the curtain. So and the pieces the company help them to do that. So can you give us like can you give us a couple like examples what exactly pieces does for them? And the reason I'm asking this question is because when we are talking on different forums and then in public space we hear, hey, yeah, there is AI but there are not so many cases yet. I know that we can use AI for this and that, but then maybe in a call center, but we need to wait, we need to this and that. So, but here you're talking about first, very specific things you guys help with. I want to spend a little bit more time on that, talking to you about it. And the second thing, it's healthcare. It's not marketing. I mean, I know in
Right.
marketing you can also make a deadly mistake and your company can lose like reputation and wherever. But if you
Yeah.
hit that 5% of the people with the wrong people with wrong email, assuming that email is like legally compliant, nothing happens. It was just go to
Right.
the spam box. But if
Yeah.
you guys make a mistake, I assume I don't want to be in that situation when the system makes a mistake and then I'm going through the procedure and the doctor or nurse, whoever we're talking about that, is a victim of that AI thing. So coming back to my original root of the question. So give us please a couple specific things like problems you guys solve for those guys, which we, by the way, thank you so much, guys, for your service. But give us a couple things, Josh.
Okay. You raised a couple kind of interesting ideas there, and the way I see it is we'll break it down. You an example of how our clients, a very specific case, our clients use our product today, and then talk about some of the other technologies we need to ensure that
Yeah.
level of safety and privacy and just guardrails really on where we are today in the industry. So let's start with a very specific example. Right now,
Mm-hmm.
we have we have several large hospital systems of our as clients. The ones I'll rattle off a few names of like Houston Methodist in down in Houston here, Parkland Hospital System, Dallas Children's,
Mm-hmm.
Texas Health Resources. These are hospital systems that we embed our product into their Epic EMR, right? Their EMR is
Mm-hmm.
basically that big, whenever you see somebody in a doctor's office typing away, okay, as they're trying to talk to you, they are typing into their Epic system, right? That is where you
Mm-hmm.
record all of your notes, all of your observations and vitals flow into. It's like your system of record, right? And that's when you hear, well, what's my electronic medical record? Epic hosts that, and that's all your medical data for that encounter that has come up. So let's say, for instance, and hopefully this never happens, but let's say, for instance, you know
Mm-hmm.
someone who has a heart attack, okay,
Yeah.
and they then you rush them to the hospital. Uh, you get triage from the ER, and then they go, okay, we need to transfer you into either the med surge unit or internal medicine and observe you, and then diagnose and figure out what's going
Mm-hmm.
on, why you had this heart attack, and we're now going to transfer you to the inpatient scenario. Okay,
Okay.
so what happens is when you get transferred to the inpatient scenario, um, your care team spawns up. An internal medicine doctor comes in, nurses
Mm-hmm.
and the case managers start triaging and say, okay, what's the status of this patient? Da 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 da. They go
Mm-hmm.
back and forth. Look at diagnostics. They look at the note that came from the emergency department, and they create what is called the very first note, an H&P note, history and physical
Yeah.
kind of assessment
Mm-hmm.
of what's going on. So at this point, what starts is a massive amount of data being produced
Yeah.
that has to be coordinated across that team. Notes will be
Uh-huh.
generated every day until you get discharged. The
Yes.
case manager will start creating notes to start looking at things like, okay, is the family taken? Does this person have family? What is their living situation? Because they want to start to be able to predict what's it going to take to when they get healthy to have a good discharge for this patient. They don't want people
Mm-hmm.
just living in the hospital system, and nor do you want to be living in the hospital system. So they
Mm-hmm.
start generating notes about things to do. Then the nurses are constantly they're at the bedside more and looking at vitals and seeing what the doctor is saying for given directions and diagnosis, and that triggers a set of policies and workflow for the nurses on the ground. And of course the
Mm-hmm.
doctor is there to assess what's going on, give diagnoses, and order labs, meds, imaging. So each day that this happens, we're getting a huge amount of data. And just to kind of give you an
Mm-hmm.
example, like a typical 5-day stay at the hospital will generate over several hundred pages of just clinical notes.
Oh my
And
God.
if
That's
you want to think about it, it's like half of a Hamlet. If you're reading Hamlet, which I think is like 350 pages, typically you'll have like half a Hamlet of just progress notes and updates about what's going on. So that in of
mm-hmm.
itself is just way too much information for any human to read and catch up on, and then be able to collaborate on. So
Mm-hmm.
so what happens is what's been happening in the past is, you know, the nurses and case managers are just spending more time trying to read more notes, just doing whatever they can to keep up. So and the doctors are
Mm-hmm.
trying to do whatever they can do to get as fast as possible to document. So they'll just start copying, pasting their last note, updating it as it goes. But then when that copy and paste action actually can exacerbate more just errors that had happened in previous notes, they just get kind of, copy and pasted forward. So you see these kind of problems emerging,
Yeah.
and then just coordinating and all that data is now a problem. So our product then inserts in, we get real-time feeds of data from the hospital system. So for instance, let's say someone went into Houston Methodist. This is all running in production and live now in those hospital systems I mentioned. Um, we we take all of that, all those data that's coming out, all the vitals, all the nurse, case manager, physician notes, um, the imaging result data. Okay, those the med orders. We're getting all that information, and then we're looking at it holistically and creating a very succinct 3-sentence summary that allows
Mm-hmm.
everybody to just do great handoffs, quicker, more seamless handoffs, and and then there's also this notion of this process at a hospital system called MDRs, which are multidisciplinary rounds. And basically, if you think about it, it's like the stand up or the scrum for the care team. They get together, start talking about a patient, they pull up their chart maybe, and they just sync on where this patient is. So having a
Mm-hmm.
summary available for those people there helps them get on the same page a lot more quickly, and remind you
Mm-hmm.
they have 14 other patients to go through on that day as well. So
Okay.
it's all about getting these efficiencies to collaborate better.
That's
So our initial
mm-hmm.
yeah yeah sorry
Mm-hmm.
our initial products have been really focused on summaries. We then show these barriers to discharge, which really helps people like the case managers be able to see things in the data about, hey, this person, um, we see a barrier here by something that was mentioned in a note, that they don't have a ride home, they don't have immediate family that's contactable, and then there's a procedure for how you then go get that assistance for that person that doesn't have that has that barrier to discharge, right? Because they can't just put someone out in the street, right? They have to coordinate at least somebody or somewhere where they can be they can pick up and send them off to. So all those little things, we then the AI goes in and just generates that summary, identifies both clinical and non-clinical barriers to discharge, and these are all just more tools to help them be a lot more collaborative and hopefully save time in the process. So those are our current
Okay.
products, and I'll talk about later if you want some ones that we're releasing um, to our first clients in the next couple months, which go to the next level of efficiency that we're trying to get to. So
Sounds to me like you guys not like automate and use AI for like many different tasks
right,
that it's like what you are. I didn't want to interrupt you because you are like you mentioned many different tasks, different nature of tasks
right,
that you
right.
guys taking or like helping. That is that correct, right? So so
Yeah.
but you still are you are close to procedures, which I believe I'm not even mentioning like HIPAA, but other regulations or maybe other obligations that you need to be aware of. So, am I right that if you want to step in and help the hospital and caretakers, technology is one thing, but then being compliant and transparent is another thing. Is that a big deal in your projects?
Uh, when you say compliant and transparent, well, let me explain the relationship with the hospital system, just
Okay.
so you can, and maybe this will, and if it doesn't answer your question, then we can clarify. So when we go into a relationship with a hospital system, it's usually like a year and a half, 2 year kind of sales process, which is maddening to
Oh,
me because
wow.
it's just so long, right? But there's for reasons for just organization within a big system, but it's
Hmm.
also because we go through a very heavy vetting process and contractual agreement, and we agree upon these things called BAAs that that allow us to have access to hospital system patient data. So we we
Okay.
we, we have a very rigorous process.
Which requires HIPAA compliance, right?
Exactly. Yeah. Like we're constantly every year we get re-upped on our audits and certifications
Yeah.
around, SOC 2 type 2 compliance. And that shows and proves that okay, a hospital system can trust us with their data. When we get their
Yes.
data, we isolate it, we physically and logically separate it so that we're just performing our insights on their data. It never leaves anywhere. It never is sold anywhere. It's never used except for in the functions of the products that they want us to get
Yeah.
insights on with their data. So the flow of data, like they'll send us these messages. They're called HL7 messages that are basically just another protocol of healthcare data that can come in a nice real-time message-based way, right? But we
Hmm.
set up, our servers together. We lock them down under VPN tunnels. The data flows in. Our AI algorithms run on it. We also have adversarial AI to ensure the accuracy of that.
Hmm.
And then
Hmm.
we send the output back into their Epic EMR. And this whole time we're doing all the authorization against their Epic EMR system. They're considered, uh, the master identity provider, and we just do, the OAuth 2 kind of protocols with them. And so the data just sort of flows through that loop back into their system, and and the team on the ground are using the data as additional information to help them in their decision making. We are not at the level, nor is the industry at the level yet, where we necessarily want or have the ability for these AI systems to to go in and like say, oh, we see this in the data, start ordering them Tylenol or order this MRI, right? We're not in the more agency based approach where we're doing actions on behalf of the clinician. We're at the stage where more we're showing them more insights about the data to help them make decisions better. But at the end of the day, they're the ones typing the final notes that go into the official medical record, and they're making their own decisions. We're just giving them more aid and
Okay.
assistance on what's going on.
Okay. Okay. But you mentioned something that I wanna, because like many people, I bet many people think that AI, the time for AI will come, and obviously in some part of the business, it's still true.
Hmm.
But your company is a perfect example. Like this is happening here and now, and the same time, you need to be aware of the fact that you actually keep sending patients' data from point A to B, and that needs to be compliant. You need to look at the procedures. It cannot be like, oh, we want to go whatever we want to, even deliver the productivity. You need to deliver that productivity, that efficiency in a way that it's a proper way. That's what I want to ask you
It,
this question, and then and you
yeah,
cannot go like freeway, because it's also a regulated and way of doing things. And then also like the fact that you guys get so much data about us patients, it's also important, because if that will not go the proper way, it can be either I would say harmful, or maybe not put in another way, it might be not used in the way it should be used to deliver that productivity. So either way, you need to be careful. It's not like you drop like a
yes,
prompt to LLM
right.
and it will give you a result. And if it's like kind of random result, but you're still happy, you need to really make sure it's going. So, but tell me,
Yes.
Josh, yes, tell me, Josh, now, what do you see in the healthcare industry? Like when it's going, like we know that United States is there is insurance system, and we know how that works. But when the industry is going, and what they actually expect, maybe from AI, maybe from data, and then are is that the industry that is dynamically looking for a change, or maybe because of regulations and other things, they need more time to get the adjustment to the AI times. Not everybody can be that as fast as e-commerce, for instance, that they can step
Yeah.
in further quicker because it's all digital. Here we have different cases, different scenarios. So can you give us a comment on that from your perspective?
Yeah. Yeah. It's a very interesting, multifaceted question. So what I'll say is here's my this is my take of it right now. So, okay, fundamentally, when we're talking with hospital systems, their general stance is very conservative and very defensive by just the sheer nature of the business, right? Like you said, it's
Mm-hmm.
not an e-commerce company trying to get more
Yeah.
clicks on a product, where you can be a little faster and get data whenever you want, and try and fail very rapidly, right?
Yes.
So for a hospital system, they're really trying to understand the risk, but also the reward too, because a lot of hospital systems, while people get some, doctors and others get paid well in there, they don't make a lot of money per se. They're not really like cash cow companies like Google or
Yeah.
Microsoft, right? Um, so so they have realities and pressures on their budgets too. But what I will say overall in the industry is, as I mentioned before, there's a crushing amount of documentation that, frankly, I don't see us as a culture or as a society giving up on like there's a world where you could say, well, how about we help everybody and on the care teams by you don't have to document so much, and we're not going to sue you, and like we're not here looking after it, and we could try
Yeah.
going that route as a culture, right? And that would help solve the problem, right? Or you would just say nationalize it all and have a system like others in Europe, where there's a lot less of this just um, this 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 compliance aspect, right? Because it's like
Hmm.
one system and you take it or you leave it, right? And this is how we bill, and that's what it is, and you pay that. So, and there's a lot of beauty to that, right? But I do not see, at least in the US, that trend going that way. So you have this
Hmm.
force now of people just adding more documentation, wanting better accountability, wanting better insights, wanting their questions answered on what is going on with my patient care. Okay. So, so that's a force pushing the hospital system. So they're all realizing like we need to do something, or we will be, or like every doctor will quit at some point. Like it will just
Hmm.
be so much of a burden. So these technologies are actually there's a lot of interest in the start of adoption, because it's being seen as, and is showing in many specific tasks and instances, to be a way to start getting some of those productivity gains back, to reduce that 50% burden, hopefully down to 45, and then 40, and then who knows, maybe into the 30s, right? So everybody is realizing we have to start making investments. Now, what I will say
Hmm.
is we're still in a phase of the industry where, like you mentioned, there's a ton of tasks that happen. You can almost view a hospital system as thousands of use cases and tasks that that need to be kind of solved in real time. And there's no one like magical AI tax that we can apply that will get like 30% productivity gains. So we're in a part of the industry where we're employing these new technologies, which make summaries so much faster and reliable,
Hmm.
which will able us to generate notes. You know, a lot of the time is spent, like I mentioned, copying and forwarding a note, and and then and then being able to sort of incorporate new data, and that will save time for that clinician who has to write that new note, because it would already be done for them, right? And then even ambient listening, speech to text, that will then generate a note. So these technologies are showing like, yes, okay, this is, we projecting this will really save us um, huge amounts of time, and
Hmm.
we're just in this early phase where there's some use cases that are hitting. It's not getting the 50% productivity that we were hoped right away, but we see that if we just keep stacking all of these wins from these AI tasks that we can employ, we'll
Hmm.
start seeing transformation of productivity across the enterprise. So it's not mature by any stretch of the imagination, but we do have some very cool examples. Like for instance, our summaries. Right now, we've delivered
Hmm.
almost 3.8 million summaries, clinical summaries across our hospital system base, and
Wow.
we're seeing that on average that saves about like 10 minutes to 20 minutes a day of just clinical chart review time. So
Okay.
you look at that, that's not 50% reduction, but it's a nice single, and is a nice product that then leads us to be able to do note generation, which we're going to deliver next, to be able to generate notes automatically based on all this data that's coming in. And then hopefully that gets another, 45 minutes of savings. So we're
Hmm.
starting to stack these kind of AI wins together, but there's just so many use cases that to
Yeah.
really see a global productivity across the hospital system, you have to deploy a lot of different use cases, and that's kind of where the industry is going, and where things will be, I think, focusing on over the next
Hmm.
the next the next several years. We do not have AI technology yet that I'm aware of that is so robust in terms of like, everyone talks about AGI, right? Generalized
Hmm.
intelligence,
Yeah.
that
Yeah.
that you can just give it a task and say, well, figure out what
No.
blood pressure
Yeah.
and meds should be used at this point. We don't have that
Yeah.
yet, and frankly,
Yeah.
nobody's. nobody's really sure how even what that means. So we're still
The-
very much about optimizing these tasks, and
yeah.
that's sort of where we are. What I will say, just to wrap up, is there are a couple cases of some big wins, like bigger productivity gains being, and largely we're talking about productivity gains on the clinical documentation side now, um, and as opposed to medical innovation. That's a whole different area. Um, hey, Art, are you still there? Sorry.
Yeah, I'm here. I'm here.
Okay, sorry, my fault. I thought I just clicked off for a second.
No,
Um,
no, no, no. I'm
the
listening. Yes.
Yeah, so one of the big areas of productivity gains that we are seeing is more on the outpatient side, where which is a very tighter loop and interaction. This is where you you go into your primary care physician, you're there for a couple hours, you go home, a note's still generated, then you're not admitted and you're not staying in a hospital, right? It's called outpatient or ambulatory.
Mm-hmm.
So there's some gains being seen there with companies that are doing the ambient listening and then helping that doctor auto generate a note. It's a
Mm-hmm.
very so and they're seeing, like, yeah, 20-30% savings in that note creation time, which is great. And that's starting to prove that, okay, these technologies are really, when you can fit them into the workflow correctly, um, it like, this can start transforming healthcare. Now,
Mm-hmm.
that specific use case, for instance, though, is not, like, needs a lot more work to work on the inpatient side, we realize, because the interaction and the workflow that the physicians and the care teams are doing, we can't just take that same technology and pop it into the inpatient side, because the interaction with the patient's different. Sometimes the patient isn't even conscious when you're there, right? So what are you going to use ambient to record a note for? So we're seeing where, in this case, maybe it's more about getting little snippets of what I want to put into my note alongside all the other data that's coming in, and then boom, a note's generated. So this is where, like, it's hard to say we're revolutionizing productivity in the AI, in the health industry, but there's these little, I'm calling them singles, of just productivity gains that, when you just keep stacking and adding them up, will deliver that transformation. And hospital systems realize that they have to start making investments on this, even though there's no
Mm-hmm.
home run right now. So
Well, thanks so much for the comprehensive description. I was laughing a little bit because there were people that were promising like thousands of robot taxis by 2024, and it didn't happen. And believe me, I'm at the position that I prefer to remove that tedious task from the healthcare and optimize what can be optimized, and I prefer that than waiting for like robotaxis or AGI. So I think that's most important what you guys do. You give us a very comprehensive description of how this productivity can be increased, change processes, summarization, and things like this. I really appreciate that. And since we are slowly approaching the end of our time, I have two questions. One is like connecting to, imagine the entrepreneurs, people in the healthcare business, they listen to us. What would be your advice regarding AI projects? Like very something very practical that people can take and use, maybe inspire them a little bit if they want to do it. I'm talking about practical AI. So let's say there is a guy or girl or woman or whatever, and they thinking like, I want to go to AI, but I want to do practical things. I don't want to stay in the future. I mean, talking about the future, I don't
mm,
want to talk to people about like theories. So what would be your advice if somebody wants to because you guys bringing AI in a practical way, so what advice can you share with people regarding this?
yeah. Okay. Here's my hopefully not too jaded view of what you need. So one of the fundamental things is a tight like, someone who is clinically trained, whether it's a
Mm-hmm.
great nurse, um, board certified doctor and technologist pair, right? Like you have to establish that like what does that tight working relationship look like from the beginning. And so
Mm-hmm.
for instance at Pieces we hire a lot of board certified physicians that embed directly with our AI team, and in fact they're both writing prompts together. Okay.
Okay.
and 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 I would start looking for those type of clinicians that are really excited about Python programming to be able to do these kind of prompt engineering kind of tasks. And it's not so much just to do prompt engineering. It's we want to solve a problem, like for instance barrier. We want to be able to identify these clinical barriers from these 5 different nodes, right? Okay, great. Let's now set up a discovery process where we write the code to extract that, run it into the prompt. We keep iterating on the prompt, looking at the output. I'm going to
Mm-hmm.
evaluate it clinically, and then say, "Yep, we now surface great barriers." Right. So you have to establish that we call it the flywheel effect of just that clinician and technologist working together to produce those kind of those kind of we'll call them those AI product wins. So you need to
Mm-hmm.
start there soon. It's going to be very hard to like. I think it's a lot harder for someone to just say, "I'm a great technologist. I think I have a cool idea on how to summarize notes better. And you know what? I'll talk to a doctor towards the end of the process and just verify things." I think that's
Mm-hmm.
a harder route in the healthcare space if you really want to have an impactful thing. So
Mm-hmm.
that's one. That one's a little more kind of like duh. If you should have that, but hard to really like. You need to get into that day to day workflow of just tight collaboration. The second part is like you have to budget and make the time in for the infrastructure required to even deliver your solution when it's ready. Okay,
Okay.
because you will hit a wall of resistance from
Uh-huh.
anyone who wants to try your product in the healthcare to even adopt it, right? So, and they're going to have a
Uh-huh.
million questions like, well, how are you storing the data? How are you going to send it to us? How is this going to work?
Yeah.
How do you, so you have to like have those questions like answered, and they want to work in their EMR generally, right? They want to work in their EMR. So you better get pretty good about integrating in an EMR, right? There are
Mm-hmm.
other plays you could do more on the billing and coding side where you don't need to be in the R as much. But so that's a different play, right? That's all about billing and coding and looking at how the revenue gen is happening. And that one you probably don't need as much integration. But if you want something practical where you're
Yeah.
influencing kind of healthcare decisions, you have to think about that ML ops to integration process and start building that now because great, you have an amazing, cool product. People may ship you data and you can send them back a CSV file that says, look at these great insights. And then you
Mm-hmm.
will wait 2 years to even be able to employ that, deploy that. So, so like that will just that you'll run out of money by then and you'll be so disillusioned in the whole industry that you have to start thinking about it now and having those answers and developing it and yeah, and developing the partnerships where even if you're not quite ready, they're willing to invest in you to start making those connections. So
Yeah.
I don't know. I just see a lot of companies be like, "Ah, oh, hackathon! I made something that takes my smart bit, my smartphone, my Fitbit data and has an insight." And cool. If you want to do a consumer product, that's a whole different beast too. No EMRs, but if you really want to push a more bigger healthcare uh, kind of initiative where you're with providers and things like that, you just have to start thinking about those two things.
Okay, thank you so much. That's super interesting, Josh. I could like talk to you for next 2 hours
Yeah,
for
right.
sure, because
Likewise.
you have a very practical view, and I love the practical view. As a consultant, I really love that. But last question is where people can find you, and tell us this, where they can approach you, like talk to you and reach out to you.
Sure. I mean, you can, if you want to know more about Pieces Tech, you can go on the website, piecestech.com, and kind of see the products. To reach me specifically, uh, more than happy if you want to send me an email, josh.grob@piecestech.com, or LinkedIn. You can feel free to mention that you heard it on this fantastic podcast, Arik. I really appreciate it again. But yeah, those two kind of things, email, um, LinkedIn, those are great. I don't have a huge social media presence or Instagram kind of thing, or but maybe that will change, and I'll let you know. But those two areas are pretty good right now.
All right. Thank you so much, Josh. I really appreciate your time. Thank you for a really extensive story about the company, but also or all the assumptions, conditions, and situations that you guys going through and bet on. Thank you so much to everybody that stay with us up to the end. Thank you so much, but I couldn't be more myself asking you for a feedback too. So if you guys can drop the feedback, share us your thoughts and comments, that would be great. Otherwise, thank you so much, Josh. You have a great weekend and enjoy the next weeks of building that fascinated company and helping all of us to have an easier life. Because if you help the care team, you also help us. Thank you so much, Josh.
Thank you so much. I have a lot of gratitude for you having me on. I really appreciate it. Thank you.
Of course.